Hello, welcome back. I'm Jason Goodwin, and this is Cherry Chapter 20. Today we're going to talk about effective delegation and supervision. Something that, whether you like it or not, comes with the license. So we're going to talk a little bit about that. Okay, so a couple things to understand about delegation and supervision. The ANA characterizes this as the transfer of responsibility for the performance of an activity from one individual or another, retaining accountability for the outcome. Now, if you notice, the words responsibility and accountability are used in this definition. It's important to understand the difference between the two. Now, you can delegate as a nurse. You can delegate responsibility as long as it's appropriate under the guidelines that we'll talk about later. You can delegate responsibility, but you cannot delegate accountability, right? So understanding that means that you can assign something to someone, and it's their responsibility to complete it, but you haven't given away your responsibility to verify it and make sure it's done correctly. So there are 5 rights to delegation. We'll go through those now. In order to delegate effectively, you have to double check yourself and ask yourself whether these things are in place. And it's a learned skill, but once you learn it, you'll learn how to do this intuitively. But number 1, am I delegating the right task? Is this the right task, and am I asking the right person? Usually that can apply to roles or even personally. Is this person, am I delegating an advanced task for that role to someone who's brand new on the floor, right? And next is right circumstances. Is this the right scenario where I might need to delegate? It may be an appropriate delegation, but is there an emergency happening, or is it there are extenuating circumstances that make it maybe not the best idea? Third, the right person. Is this the right person performing the task? And by that, we mean the role that that person is challenging. So, you know, if you can't delegate a nursing responsibility to a respiratory tech or a CNA, right? So you have to understand who you're delegating to and why that's appropriate. The right communication. This is imperative, and it's something that all of us can continue to work on. It's about clear, concise description of the task. So, am I describing the task that needs to be completed, and am I giving that person enough information to complete it, which includes objectives, limits, and expectations, right? Oftentimes it's also helpful to establish a verification time. Maybe the language could be, when you're done with that, come back to me and let me know. Okay. And finally, the right supervision. What's the appropriate monitoring? Is that you? Is it somebody else? But how are you going to verify that that work is being done safely and appropriately? And then, of course, it's important to give feedback as well. We'll talk a little bit about how to develop your delegatee and how you can start to make that person progress on their career ladder as well. What tasks can be delegated? So there's a lot of things that regulate this and dictate this. So the Nursing Practice Act and state laws in each state, including here in California, have guidelines. The patient needs must dictate those, right? So that's number 1. What is appropriate for the patient? And if that is appropriate, then you can start to branch out on other things. The job description and competencies, policies and procedures, those are all things that the hospital puts in place to make sure that there's a baseline of acceptability in those situations. In the clinical situation, what exactly is happening from a clinical standpoint that plays into this decision? And then, of course, the professional standards of nursing practice. Is this an appropriate practice for the standard of nursing? Am I following that? The RN determines what this delegation is, right? So when you become a nurse, you will be delegating, you will be supervising the care of patients and the completion of tasks. So the RN determines what the patient's needs are, and then you're going to determine what the availability of qualified staff are in your area. You verify, of course, that whatever you're delegating is appropriate for the scope of practice for that licensed or unlicensed personnel. And then, of course, the job description or local policies in the facility that may dictate that as well. You take all of that into account when you make your decisions. It's an important job. RNs must be aware of the level of education and training someone must be aware of the level education and training someone of constituents. Having said that, so a certified nursing assistant can delegate specific activities with specific guidelines, things like bed making, bathing, feeding, ambulating, general activities of daily living, etc. The LVN performs different tasks, some of the same, but also there's nursing actions requiring specific knowledge, things like sterile technique and med administration and data gathering. And many of those things are progressing towards what some of the scope is of an RN, but there are clear divisions. The RN implements the nursing process, and he or she develops a nursing care plan for the patient. And we alone implement that teaching plan. We plan for patient discharge, and we follow up and evaluate the delegated task. So we're managing a lot of things at the same time, but one of the important things, and we'll talk about why this comes up in legal complications later, but one of the most important things is that as a nurse, you're verifying what you've delegated. You have that responsibility. The delegatee, I said it right the first time, is accountable. So when I delegate something to someone, that person is accountable for their own actions. They're a professional just like anyone else. They're accepting that delegation within parameters of their training and education. So in other words, it works both ways. If a doctor comes to me and delegates something to me and says, hey, can you start this central line? I'm not allowed to do that. That's outside of my scope of practice. And so as a professional and knowing my roles in the scope of practice, I'm going to say, oh, you know what, that's not appropriate for my role. Let's figure out how to get that done otherwise. Communicating the appropriate information to the delegator. So if something's delegated to me and it's appropriate and I go take it on, I have a responsibility to make sure that that information that comes from that is being communicated back to the person who delegated it, because it's going to be important for the patient's care. And of course, making sure the task is completed. That's my responsibility as well if it's delegated to me. Organizational policies and procedures. Super important for a nurse to know anyway, but when delegating, there's usually specific policies, and you should comply with all of the policies, including any competencies or skill requirements that are designated. That means also knowing the policies, but knowing your team well enough to know what they do and do not know. They can tell you a lot of times when you're working alongside with someone, you'll get to know that. But the close assessment of that is going to be critical. Written policies will usually describe the supervision, what's required, what's appropriate, what's not. From a risk standpoint, that's the more clearly that's conveyed from a facility's perspective, the better. So there's some legal concepts. I talked a little bit about this before. I consult on legal cases periodically, and the most likely themes that I see in the work that I do is it involves standard of care, policies and procedures, and the role or the scope of practice consideration. So those are the questions that are asked. If there's an issue with nursing or a facility, was the standard of care followed? What do the policies and procedures say? And what was the scope of practice, and how was that role designated? And very often, if one of those things isn't up to standards, then that's going to be where the accusation of negligence occurs. We'll talk about this a little bit in the future when it comes up. So finally, in building delegation and supervision skills, you have to know what the guardrails are. Okay, know where the boundaries are. Make sure that your delegatees know what those are, and reinforce those yourself. Communicate effectively. It's very easy sometimes to use language that confuses the issue. clear, strong language on where those barriers are is usually the best policy. Create an environment with your team and whoever you're delegating. Develop the team. Make sure that you have trust and cooperation. Make sure that there's a collegial relationship and that person feels invested. If you do that and you create things like an environment of teaching and learning, you'll find that you're getting better assistance and better teamwork, and also you're developing another person for who knows what could be their next career step. So, and then in that regard, you become a mentor. That's very rewarding itself. You have to promote patient satisfaction, right? So everything we do, if I'm a nurse and I delegate something and it doesn't go well, that reflects on me, it reflects on the patient's doctor. So their experience with their stay and their satisfaction is contingent upon all of that working well. And don't forget to provide feedback and follow-up evaluation with the people that you're working with. It doesn't have to be the end of the world. You can say, hey, listen, let's talk a little bit about what happened there. And so what did happen there? Well, it didn't go that well. Okay, well, here's what I'd like to work on for next time, and here's what we can do. And so, you can use that type of language to try to create a teaching moment, and both of you will be better for it in the end. Okay, so I'd encourage you to review these notes, and also don't forget to read the chapter. And there's some great tables in this particular chapter that you can take a look at. And don't forget to post any questions or concerns that you have on the Canvas page. And thank you for sitting with us today.